by clicking on the symptom link, and we see a very nice avatar here. So you can give two options. One is the specifying the symptom list manually, and the other is to specify using the avatar. So we are going to use our avatar. This is the symptom list that you can select manually, but what the doctor can do is that he's presented with an avatar which he can select and specify and enter some information. Like if it's an issue of the head, he can select. If it's a chest issue, he can select the chest. In case of a neck issue, they can select the neck, and they can select different parts of the body. In order to select the back side, the avatar allows you to rotate and add any specific regions of the body as preferred by the doctor. So in our case, we will select Ramiro's information as a cardiac patient, and we're going to select the cardiac region, and we see that a number of symptoms reappear: abnormal breathing sounds, blister, chest pain, bradycardia, all the options. We're going to select the ones which are suitable. We're going to select chest pain and chest pressure, and after selecting that, we're going to click on the next button, and we see the number of conditions. Conditions can be coronary heart disease, chest pain, unspecified. So since we have got a specified chest pain, let's give it a coronary heart disease or a coronary artery disease. After placing next, we see a lot of investigations are automatically suggested. Now the doctor can suggest custom specifications or medications or investigations, or he can select from the series of common investigations that are primarily specified based on the cascaded information that we have been collecting till now. So we're going to select CT scan and electrocardiogram, and we're going to move forward. After we click on next, we see a list of medicines which the doctor can suggest. Let's give ranitidine in order to suggest a medicine, and aclovir. After selecting acyclovir and ranitidine, we move forward, and we see here is a default information which we have entered, and based on that we can go to the next round. You can see, you can even take a printout of this. This is the basic information which we had previously, and now we have got the investigation or the symptoms information already in place. Now you can add some investigations and medicines by clicking on this link. So already 2 investigations have been added here, and you can also save this investigation, and you can see the list of active investigations and the past investigations. This is the primary consultation of the patient, so we don't have any past investigations, but we have got the active investigations which we just added. Then we will go to the medication, where we can add medicine for the patient. You can select here the day from which the patient should take the medicine. So will it be a routine medicine or an urgent medicine? So we will give an routine medicine. So we have got 3 ranitidine. We can select the medicines by just the names, So this is a specific feature, a state-of-the-art feature for the doctors, where you can select the medicines by just clicking on one name, or by just giving the first word of its name, or the first character more specifically, and this will remove a lot of burden from the doctor's shoulders. It will ensure that the doctors do not have, even they don't remember the whole name of the medicine. Out of the large area of medicines, you can just give one word. For example, I'm just going to give R for ranitidine, and see, I get all my suggestions here. You see, ranitidine, I make it more specific. I give an RA. I see ranitidine at the very top of my list. So I can select any version from here. We have got the 300 mg, 150 and 75 mg. So I'm going to select the 150 mg from here, and the route of the patient by which the patient is going to take this medicine, we're going to select mouth. Any specific instruction as directed, and start time, the priority should be routine. So single frequency, we can add separate doses or single frequency, 1 time a day. So we can select now medicine or one of medicine, And dose per take, let's select 1 tablet per dose. Frequency, TID stands for 3 times per day, and BID stands for 2 times per day. And we have got a lot of options here, and we can select any one option to specify the dose in which this medicine is to be taken. I'm going to select TID, which I repeat stands for 3 times a day. So we're going to take this medicine for 7 days, so I'm going to specify duration 7, and in the type I'm going to specify days, so 7 days. And you see a dose is printed by the system automatically, so it says that the maximum limit is over, so I need to uncheck this and I have to click this. I can always change these links. If there's any other refill required, how many refills needs to be required, all needs to be specified. And finally we will add this medicine. You see ranitidine is already added in the medicine section. After that we have got the advice option. Once we go to the advice tab, you can see there are specific reasons for which the advice can be given. So for our advice, it will be report viewing for some next day for the patient to arrive, and the visit description, I need to check investigation reports, any specific time that we can select, 48 to 27 hours. The doctor has already added, but we can select today, and we see that the slots are reappearing. We see that the slots that are available in blue are the ones in which the doctor can see the patient, as those appointments are free. The slot that is black in color is the book slot. So we're going to select a slot that is blue, and I'm going to save this appointment. As we go down, we'll see that this appointment follow-up visit is already being saved at this specific date and the time of 2040, and fee if required. So after the follow-up visit, we have got a request for OR, and once we click on the request for OR, we see the stamping information and all the other important information, and we can add the OR if necessary. For this patient we don't have any specific OR, so we're going to move on. We're going to go to the refer this patient panel over here, and if you see any other symptoms in the patient which some other doctors are experts, our specific doctor, Mr. Rakibul here, can refer this patient to some other paramedicians or doctors. So in order to select a doctor, I'm just going to give the name, say addiction patient, cardiology, Dr. Rakibul Hassan, cardiovascular surgery. We're going to select Dr. Asim Nazim John. Since this is a cardiac patient, he may need some cardiovascular surgery, which the doctor finds out and the doctor can direct. And the reason for the referral, the doctor can select any reason from here, like we're going to select a cardiac erythema for a cardiac patient, and visit within 2 days. Need fee can be selected, and description, detailed tests on cardiac symptoms need to be adjusted. So this is one of the descriptions which you can add to give better detail to our doctor, and we're going to save this information. As you see, we cannot select the doctor specific in this specific case, because the date which we selected, which is 8/4/2016 as given here, the doctor has not added any slots in this place. So we'll only can make an appointment once the doctor's slot is available. You see the slot doesn't reappear here, and we get the message as referral appointment alert. You cannot refer patient if referred doctor does not have appointment slot. Okay, so we're going to select it immediately. The doctor still hasn't have any appointment slot, so we'll wait for the information. In the meantime, we can enter all the other remaining information, such as IPD. In the IPD admission, we have got the patient information as XYZ hospital, and we have got all the other information that are given here, and you can request for admission to the hospital in case of any urgency. Investigation summaries are given as per the other pages. After the medication and advice, the next option that you have will be the instruction option. Once you go to the instruction, you can add any specific instructions such as special diet for the patient. In order to do that, you click on instruction panel and you go to this board which reads the different types of instruction options such as nutrition level instruction, the activity level instruction, and special care instruction. You can select the nutrition level instruction. Here the instruction that we're going to give some special diets. I'm going to give low carb diet for the patient and low fat, supplemented with low fat. Special supplements, I'm going to suggest aloe vera as a special supplements. Others you can just leave it blank, or you can give not applicable according to your desire. Any other restrictions? Not going to give any restrictions. As we add this, we will see below, we'll see that in other instructions the special diets are all available. Any activities such as morning walk, I'm just going to give a yes. Any special care, dressing, tube, LV, others, no other special cares for this patient, so I'm just going to leave it blank. After I have entered all the data in the quick calculation, I'm going to give a print preview. So you can see all this data is available in printed format. You can either print from here or you can close it. So besides having a soft copy, you can also maintain a hard copy, which is very easy to generate using this software. You can generate the entire report of the patient within seconds in real time, giving all the necessary instructions from the ends of the doctor. After we have finished the quick consultation, we come up with another option, which is the historical information of the patient. Here you can add a wide array of histories such as medical history, surgical history, family history, social history, allergetic information, and immunization. As you can see here, the allergy information is missing and the allergy alert. So by allergy information, we can add this information. But let's go step by step. In the medical history, if the patient has any other medical history, such as the patient had fever, so I'm just going to give fever, Colorado Creek fever, drug-induced fever, or a dengue fever. I can just select when the patient first had this fever. Let's say the patient had this fever in April 2016 on the 12th, and when this fever ended, say it ended on May the following month, and who was the doctor treating this fever? Just give the name of the doctor. Treating doctor should be given as Dr. Asif. And any other comments? The patient has completely recovered from the historical disease mentioned here. And I'm going to save this. We're going to maintain this record as a past record to help the doctor understand any other specific symptoms or the medical history which the patient had. In terms of surgical history, you can add any surgery name that the patient had. For example, it can be a carotid surgery. Patient may have it in April. You can add the chief surgeon, Dr. Rocks Smith, and surgery reason, just pain. And we can add some specific comments. The patient was suffering from chest pain, and we will select this information. You can finally save it. You see all the details appear in this information. The patient, as a patient and as a doctor, this information will be very useful for medical recording system. You can edit it on real time, or if this information was incorrect or you don't want to keep it, you can delete this option as well. After surgical history, we go to the family history, And in family history, we give some basic family histories, whether the patient has diabetes, migraine, or allergic contract due to drugs or in contact with skin. And you can add options here. For example, the patient's father had migraine, and maybe the patient's mom had allergic contract, and we're going to save this information. And it will give you a pop-up upon saving that family history information is saved successfully. After family history information, which we have saved, we go to the social history, which you can select based on the marital status of the patient. The patient has been married for 4 years. We select the duration as 4 and we give the option as years. Living arrangement, the patient stays with family, with spouse or some other option, or with a roommate. Employment status, the patient is a service holder. You can give lots of options from here. Employed, self-employed, employee, contractor, retired, director, and service holder. The education, it can be college, professional school, or any other education. We're going to give it professional school. Memories of childhood, any other social information which the patient may need. And find your life, basically how does the patient finds their life. Does the patient smoke cigarettes? You can select yes or no. Details, he selects about 2 cigarettes a day for the last 10 years. Does the patient drink alcohol? We're just going to select no. Did they ever drink alcohol? No. Did they ever drink coffee? No. Any other recreational drugs? No. And we're going to finally save this information. Oh, we missed one thing. Once we selected the employment status as service holder, we need to enter the profession. We're going to give it a statistician, the profession of a statistician. I'm going to make it more formal. The patient is our statistician profession. And finally, we're going to select an option. And it's going to cause us to go back to this list because we need to select memories of childhood, which we left. So I left it intentionally to show you that these options are mandatory. So we are mostly happy in life and find your life. Satisfactory to demanding, generally unsatisfactory or boring. We're going to give satisfactory and we're going to save this information. So all the information has been saved and we can get a printout of this and we can see all this information below. After social case, we can enter the allergic symptoms which the patient may have. So there are 2 options. We can also select by word, which the doctor doesn't need to remember the entire name. They can just give words and they'll see suggestions. So they have got 2 options, salbutamol and pneumococcal. So let's select it as pneumococcal. Let us give it a high severity level. Reaction place, nose. The patient has got allergy problems in the nose, and whether it's active or it's inactive, we'll call it inactive. And we're going to finally add this information. Once we have this information, you see it's being added in the service of energy, and it's asking us either to edit or to delete or to save. Since we have entered this information correctly, we're going to save this information, or I can cancel if the information was not correct. And we see that in the latest allergy we have got this entry. So after the allergy, we move on to the immunization. Type of immunization or the immunization history of the patient. Probably the patient was treated for influenza and given influenza immunization, and who performed it, when was it performed. We're going to give it a specific date. Who was the manufacturer? We just give the manufacturer of the person or the company, more specifically, who made the medicine or who made the antibiotic for this specific allergy. And any other comments? Treated in timely manner. We're going to give this comment just to help our doctor identify, and we're going to submit this information. Once we click on the save button, this information is going to appear. So after finishing all this information, we have finally got our Medical system completed. We've added the history and the quick consultation, and we've also added information. So thanks for watching. You can either take a printout of this information. As you can see in the preview, all the information can be seen in details, and we have the patient's report almost ready and ready for treatment and for further actions. So as specified before, we'd like to thank you once again for watching this presentation on ATI's EMR system, which is built in a highly professional environment, taking in consideration of the needs of the people associated with the profession of medical record keeping, which includes the doctors and the nurses, and it has been designed specifically for the clients. Thank you all, and see you next time. Bye-bye.